go, well, you use Juvederm in your lip.
He's like, oh yeah, I can tell you like Juvederm because I actually see it in your lip right there.
She went home, she stared at it, called me the next day, said, oh my God, I see it now.
In that moment, I realized why my face looked different.
Over the past several years in my office, I've tried to treat patients for the face and the face alone. And part of that involves doing injectables, doing laser treatments to try to really brighten and freshen the face as much as possible, and even go to doing skincare for them as much as possible. To help me in doing this, I brought in Jenn Hollander, who is a nurse practitioner, and she is exceptional at what she does.
I've never worked with anyone like Dr. Talei.
She's taught me a lot throughout the past year. She's one of the people in the medical world I really admire. And
He's very, very talented. I mean, that goes without saying.
Backstory, this is Jennifer.
Oh, hello.
Jennifer is one of the best nurse practitioners to ever have walked this earth. When I saw her during her interview, I said, by the way, I hope you don't mind me saying, I stared at her from here to here, and then I focused in on here. One of the things that I talk about a lot or teach about a lot is the different products that people use are incorrect.
Two that are most reactive and cause the most issues with making people look worse over time tend to be Juvederm and Juvederm Ultra XC. Those are migratory fillers, they're inflammatory, and they draw in more water than the other fillers do.
We were talking about the different types of materials that we use on patients, and
I go, well, you use Juvederm in your lip.
it's like, oh yeah, I can tell you like Juvederm because I actually see it in your lip right there.
She said, what do you mean it's up there? And she got really embarrassed. I said, well, it's up there, it's in the wrong spot.
And in that moment, I covered my mouth and I really didn't know what he was talking about.
She went home, she stared at it, called me the next day, said, oh my God, I see it now. Now I see it.
In that moment, I realized why my face looked different. The lower half of my face looked older, heavier, and I really couldn't put my finger on what it was.
Since that time, she refuses to use Juvederm in the lip. She sees it from a mile away just like I do.
Like, oh my gosh, you're right, I can see this. This is awful.
She came back the next day, dissolved it, got it all out. Her lips looked a little shriveled from the collapse.
Having dissolved all of that migrated filler, I kind of went back to how I looked before, which was kind of refreshing.
We refilled it.
I immediately looked younger.
She went back to normal.
I was never really the best candidate for filler. Just my anatomy alone. My upper lip was quite thin, my philtrum was long, and I would duck out really, really quickly. And so I had to be really conservative with how much filler I was able to use.
Then a month or two later, she said, you know what? I work in this office all day. I'm seeing long lips and then having them shortened, and I can see more teeth on all these patients and how amazing it is.
The first time I saw Dr. Talei's lip lift procedure, I was just in awe because I thought, oh my God, that's my procedure. This was meant for me.
She's very shy about doing procedures and surgery, even though she's an injector. It's, all of us are.
I've worked with many different plastic surgeons, and I've had to augment a lot of surgical scars. It's your face, and it's in the middle of your face. And when you work in this industry, you see a lot of mixed type of work. It took me about 10 months after seeing patient after patient and seeing the process and really getting the idea, like wrapping my head around the idea that I would do surgery. And there was a lot of stigma also for me that just be natural and like, why do you have to do this surgery? And one day I was ready.
She came up to me one day, she goes, I think I'm ready to do it. Let's do it.
I had zero nervousness. I had no hesitation. And that's when I knew that I was really ready.
And she just jumped right into it, did it, healed super fast because she was doing all the appropriate stuff afterwards. She was doing hyperbaric oxygen treatments.
Beautiful Jenn Hollander in the chamber today.
Hi everyone.
The LED bed.
Having people guide you what to expect, how you're going to feel, and then of course having had the oxygen therapy and the LED consecutively after was a game changer.
It came out great, and we just saw our photos today. They look awesome.
It is the best thing I've ever done for my face. My confidence has gone way up, way up. And by way of that, you put yourself out there more, which creates more possibility in your life, right? So if you're more kind of closed and more reserved, you're not really interacting as much as you would when you feel more confident, you're more open, you present differently. And so you create more interactions and more possibility. It's a small change, it's dramatic, but a very small change. My lip looked dead and now it's alive.